All doctors to the ER.
I know you're smart enough to be doctors, but we have some patients, and I think, don't you think they need to look like doctors?
Yeah.
Okay, you stay there. I think I can do this. Let's see. Wait. Yes. Thank goodness I had my doctors today. So we're now in our staff meeting. I am the head of surgery, and I am giving directions to all of my doctors because there are too many patients for me to see on my own today. So here is what happened. You know, I came in, I told you there was a big emergency. I've got some footage of what just happened.
I don't know what to do. I know I've got to get this done. Oh, hey, let me let you go. Hey guys, look, I am so glad you showed up. Listen, I have got to get this report done, and I can't type it because I don't have the vowels that I need. I need a word surgeon or something to help me get this report done. Can you guys help me? I know I'm a doctor, but I'm going to need some special help. And I think you guys will be just the team that can get this done for me. So I don't know what else to do, so I'm really counting on you guys. If you can do some word surgery for me, that would help me out tremendously. So let me know what you think, okay? And I can sure use your help.
I mean, I was just up there to take my regular little quick break, and I was going to just say hi to him, and then that's what happened. I was like, oh my goodness, okay, we've got this, Dr. Kirkman, don't worry. Now, we're at the Kilby Word Hospital. This is no longer Kilby Laboratory School. This is now the Kilby Word Hospital, and you are the doctors. Each patient that we see today needs 4 things. They need a diagnosis. Say diagnosis.
Diagnosis.
A treatment plan. Say treatment plan.
Treatment plan.
A procedure. Say procedure.
Procedure.
And hopefully a cure. Say cure.
Cure.
And I'm going to tell you what all of those things mean. Today we are treating patients that are words. Our patients are words. Our job is to say and then spell each sound. That's how we can help our patients today. The biggest thing you're going to see is a patient card. And this tells you what the word is that you need to spell for this patient. Now you may look at this and say, I don't have any idea what word that's supposed to be. But you're the doctor, so you'll figure it out. There's a clue that can help you, I'll tell you. Other thing that's in here are some letters. What you're going to need to do is spread these letters out and see if you can figure out what this word needs to be. Now, all of the letters have a line under them, so we don't have to worry if they're upside down or sideways, because, you know, sometimes that can make a different letter. So, you know, doctors don't have an easy job. There are extra letters that you don't need in here. So you can't just, it's not going to use all of them. It will use 3 or 4 sounds. And sometimes there's more than one letter on a card. Because we know at doctors at the Kilby Word Hospital, we understand that 1, 2, 3, or 4 letters can go together to make a sound. So these aren't really letter cards. What should we call them instead of letter cards, you think?
Patient card.
What is on each card?
Not,
A sound, a spelling for a sound. So let's call them sound cards. So spread out your sound cards and see if you can figure it out. So we are going to look at each patient, which is each word, and we're going to figure out which vowel it needs. That's our diagnosis. And on our patient chart, the first thing we write down is the diagnosis. It says the vowel is blank. Only one letter goes there, and it's the vowel that you need for whichever patient you're seeing. What are the names of the vowels again? A, E, I, O, U. Sometimes they make that sound. Sometimes they make a short sound, Dr. Wally, like a, or e, or I, or a, or They might be doing that. Either way, you'll know which vowel needs to go there. All right. Now we're going to make our treatment plan. We're going to decide if our vowel sound shows us what our treatment needs to be, either CVC or CVCE. That means consonant, vowel, consonant. And that means a short vowel sound, that most common sound, like ed, not saying its name. Or if we hear the vowel sound and it's saying its name, what does that tell us our treatment needs to be? CVCE, because we know we need that two-letter consonant spelling at the end to make the vowel say its name. The assistant surgeon actually has to do their job first, okay? So here is a hospital bed. My job is say the sounds as I write the sound lines. Assistant surgeons, what do? Say the sounds while we write the sound lines. So the word is red. The assistant surgeon would go r, e, d. All right? Then the surgeon's ready. Here comes the lead surgeon, and they have all of those sound cards in the room with the patient. So they're going to have to think. The first sound is r. They're going to say as they move each sound card. First sound, and move it to the first line, and say as you move. So you're going to say r. And then you're going to say eh. And you're going to find it and go eh as you move. And then you'll go d. You have to decide, now wait a minute. Do I need the two-letter spelling for d, or do I need the one-letter spelling for d? That's when your treatment plan comes in handy, because you've already decided that. We circled CVC, which means we don't need a consonant at the end. We don't need that two-letter spelling, so we will move the one-letter spelling for d. And there's our word. The assistant and the lead surgeon need to double check, because you always want to make sure your patient is in good shape. So you would go r, e, d, red. Awesome. Now, you have to make good notes as a doctor. You have to keep up with what you've done. So after the procedure, both surgeons need to take their pencil and add to their patient chart by drawing the sound lines and the spellings right there where it says procedure, sound lines and spelling. So look up here at the board with our pencil. Both surgeons would go r, e, d, and then they would write the spellings r, e, d. Close. A cure means when the patient feels better and the problem is fixed, we say they are cured. So if you go to the doctor and they say, oh, I need to check back on you in a couple of weeks, and you go back and you feel completely better, they would say, oh, Dr. Eden, you're cured. It means you're completely better. Our patients are cured when the complete word is written neatly, right there where it says cured, all smushed together. So you would say as you write, ed, in your best handwriting to make sure it's cured, and then you'll be finished. That is one patient, okay? You're done with one patient, you see this at the bottom? Don't do that yet. You need to see all your patients first. These are for extra doctor notes to go in their patient file. You may have time to do that. You may have to go back. Some doctors have to stay after the office closes and add their notes in. So you don't have to do it right when you're with the patient. If you've done all the way down to the cure, you need to put that patient all back in their room before you go to the next patient. That's how you close the door of the room and you're like, hope you feel better. You walk out, everything's in their room. Then you're like, on to the next patient, because doctors have a busy life. Next patient's been waiting. We don't want them to get cranky. Now, if you've seen all of your patients, and I think you have 6 patients waiting for you because there are so many today, then you can go back and add those notes. So down there at the bottom, what you would do is you could write a sentence using that patient. So if our patient was red, Our sentence must use the word red. And then you can draw a picture that goes with each cured word. Number 1, visit each patient's room and note the patient number. Don't forget that. Number 2, diagnose the vowel. Figure out what the word is. Give it a diagnosis. What vowel do we need? Number 3, decide on the treatment plan. CVC or CVCE. You'll have to think about the sound the vowel's making in the word to make a treatment plan. Number 4, complete the procedure as either the lead surgeon or assistant surgeon. Assistant starts by getting the sound lines ready. The lead surgeon comes in with their tools and moves the sound cards to the sound lines. Then both surgeons need to record it in the patient's chart. Finally, you've done all the hard work, write down the cure. Both doctors have to be ready before you move on to the next patient. You are a team of doctors. You can't go without both of you. If you've seen all your patients and you finish early, go back and add the patient notes to help you remember each patient.
Dr. Gabriel? Yes. And Dr. Yep.
We're getting ready.
So wash your hands.
If you already have that plan for your first patient, go right ahead. Look at your options here. Does it look like the word talk is this patient? Ooh. Well, you're getting closer, I think, but I still don't see. Do you see all the sounds you need to laugh? What's something that might make you laugh? If somebody tells you one of these. Like, oh, that was a funny.
Joe.
Do you have the sounds for Joe? Okay, wait just a minute. Let's get the assistant surgeon. Say those sounds.
You don't need a CVC. You need a CV.
Oh, your treatment plan changed. Did you already have yours written down, Dr. Banks? All right. Here's the patient. So we need to figure out what word this is. What word do you think that picture shows? And it's got to use some of the sounds up here. I'm going to take a few of them away even. What is this a picture of? What do you think, Kayla? It could be a mirror, but let's pretend like there's nothing in the middle there. It's just around a picture or something. Maybe go around a picture. What if it's a frame? Say frame. Frame. You know what a frame is, right? You can put a picture and it goes around the picture.
Just like when that.
So this is a frame. So who is the assistant surgeon for this patient? Okay, so this is what you need to do, Dr. Eden. You're going to say the sounds as you draw sound lines for frames. Say each sound. What's first? Very nice. That was a great job as the assistant. Artist frame. Go ahead and move the first sound to the first sound line. Say that sound. What sound? Okay, go ahead and do the next one. Oh my goodness. Dr. Eden, yes. What sound? All right, do the next one. Awesome. Oh, now we have a decision here. Do we which spelling? Why did you pick that spelling for Dr. Kayla? Do you agree, Dr. E? I do too. Go ahead and move it down there. All right, now we've got to get our patient's chart updated here. We have moved along quickly. Do you have your patient's chart? All right, here we go. Patient 25, the diagnosis, the vowel is what? All right, for the procedure, you're going to draw the sound lines again right here and say the sounds as you write them down.
Okay, the vowel's a white bone. There's an E at the end, so. Okay, let's do this. Nope, not yet. Oh yeah, I forget we have to do it. Now just use your hands. Okay. Okay. That patient was fast too. Yeah. Now on the assistant. Okay. Patient the vowel 4. There's no more in here. Okay. Cloud. Wait, let's see if we have letters to spell. Tipping cloud. Ford. Ford. Oh, good. Yep. Good job, Pear. The vowel is wait, let me see. Yep. And it doesn't have an E at the end, so it's CVC.
It's really bright, not as bright, and not as bright.
Is it CVC or is it CVC?
It is.
Okay. And then here you go, lead surgeon.
Pencil. And there's not an S here. Wait, let's ask.